We are talking about the high-yield anxiety disorders that will show up on your exams. You need to know your neurotransmitters for the exam. Norepinephrine is increased in anxiety, whereas serotonin is decreased and GABA is decreased. You need to know that anxiety is the most prevalent form of psychopathology in psychiatry. Specific disorders, starting with generalized anxiety disorder. So generalized anxiety disorder is defined as excessive worry about a whole bunch of different things for at least 6 months. Pay attention to the timelines because test makers like the timelines. The symptoms may include restlessness, feeling keyed up, fatigue, because worry makes you exhausted, impaired concentration, irritability, muscle tension, and it can make it difficult to sleep when you're anxious, so insomnia. So how do we treat generalized anxiety disorder? We use a combination of CBT and pharmacotherapy, which would be an SSRI or SNRI. Remember, on a test question, if you're getting asked about the treatment for an anxiety disorder, most likely the answer will be a SSRI or SNRI for treatment and then CBT for therapy. I will talk about panic disorder. Now, the criteria for panic disorder is 4 or more attacks in a 4-week period or 1 or more attacks, followed by at least 1 month of fear of another panic attack. Now, how do we describe panic attacks? They're a sudden onset of intense anxiety, and they typically peak within minutes. The symptoms are very particular of dizziness, disconnectedness, derealization, depersonalization, palpitations, paresthesias, abdominal distress, numbness, nausea, intense fear of dying, losing control, or going crazy, chest pain, chills, and sweating, shaking, shortness of breath. It's important to note that the difference between an anxiety attack and a panic attack is panic attacks, you don't feel like you're having an anxiety attack. You feel like you're going to die from something physical. Like, I feel like I'm going to have a heart attack. My heart was about to beat out of my chest. I thought I was going to die in the moment, and that sounds more like a panic attack versus an anxiety attack where you just have this overwhelming anxiety. So panic attacks and panic disorder can lead to agoraphobia. Now, agoraphobia is defined as an intense fear and anxiety about more than 2 situations, typically open spaces, public transportation, crowds, something where you're out in public, due to concerns about difficulty escaping or obtaining help in case of a panic attack or humiliating symptoms associated with that panic attack. This leads to the avoidance, and the avoidant behaviors can be very extreme, like in the movies where you see that person that refuses to leave their house because they're afraid of going outside and being in crowds. The treatment is CBT and SSRIs, which are typically always the answer. Again, very, very high yield panic disorder can lead to agoraphobia. Next, let's talk about specific phobias. So a phobia is a persistent excessive fear elicited by a specific situation or object that is way out of proportion to the actual danger that that object or situation presents. The duration of symptoms must last several months. Treatment, CBT. Again, CBT is always the answer when they ask about therapy. Now we will talk about social anxiety disorder. So social anxiety disorder is the fear of scrutiny by others and the fear of acting in a humiliating or embarrassing way. The fear may be limited to performance, such as public speaking, and that's the performative type of social anxiety disorder. Treatment, first line, CBT. If CBT is not enough, then SSRIs or SNRIs for debilitating symptoms. If they just have the performative type of anxiety, beta blockers can be very helpful. High yield, you need to know the difference between social anxiety disorder and avoidant personality disorder. So social anxiety disorder, the person fears embarrassment, whereas avoidant personality disorder has this hypersensitivity to negative evaluations and feelings of inadequacy. You need to know this because they will put both of those in the answer choices, and you have to know how to distinguish between them. Lastly, you need to know how to rule out medical causes of anxiety. So first, let's talk about anxiety due to a substance. Alcohol withdrawal, common cause of anxiety that is on test questions. Cocaine intoxication also can show up on test questions. It causes anxiety. And then the most common cause of a substance-induced anxiety symptoms is caffeine, as you should know if you're a medical student. Common medications that can cause anxiety is antiasthmatics, amphetamines such as Adderall, methylphenidate, and then thyroid hormones also can cause anxiety. There are other medications too, but those are some of the common ones. Finally, medical conditions that can cause anxiety. Hyperthyroidism, commonly tested on exams, hypoglycemia, and neurological disorders. Cardiac conditions such as MI or arrhythmia. This is why if you have someone having a panic attack when they go to the ED, they get an EKG, they make sure that there's no cardiac problems that could be causing this anxiety because we don't want to miss the medical condition. All right, rapid review summary. Generalized anxiety disorder, worries over everything for at least 6 months. Panic disorder, recurrent panic attacks that can lead to agoraphobia. Specific phobia, an intense fear over just one thing. Social anxiety disorder, fears embarrassment in social situations. Anxiety due to substance or medication, the anxiety should be happening after the substance or medication is consumed. For anxiety disorder due to another medical condition, look in the test question for signs and symptoms of a medical condition, and that will typically indicate that it is anxiety due to a medical condition. Let's get you easy points on your exam. Good luck.